When I was 20, I got diagnosed with chronic fatigue syndrome, and because of that, I sort of went down the journey of looking, well, obviously just trying to get myself better, and I went down the normal doctor route for about a couple of years, and I didn't really get very far, so I sort of gave up with that and then looked more into different types of alternative medicine, and mostly in the sort of nutritional and naturopathic and detoxing type route, and that got me somewhere, but it didn't seem to have the answer and it didn't seem to sort of click me very quickly back to being well. And so I started reading a few books on energy medicine, which, to be honest, I was totally skeptical about at the time, because I was still in a biochemical model, even though I'd moved to, the doctor was saying to me, well, yes, you've got it, but there isn't anything you can do about it. The only explanation they sort of had was that it might be related to some sort of viral illness, but they also didn't know. And then other people thought, well, maybe there's something wrong with your biochemistry or something like that. My chronic fatigue syndrome was extraordinarily bad. I mean, I was bedridden for about 4 of those years, and for around 6 of those years I was mostly house bidden, really, and I could only sort of wander from room to room, and I'd have to have rests pretty much all the time, and like quite a few of the different symptoms, like my glands were always swollen, I'd have a very fuzzy head and big headaches. I think I used to get liver aches and stomach cramps and quite a lot of endless symptoms, and actually my back was extraordinarily painful with great big sort of knots in it all the time that couldn't be eased to however many massages I had. It's a bit like living in a black cloud, because I mean the biggest feature in your life is actually the ceiling above you, and it's immensely boring. I couldn't even really describe it, and all you're really ever thinking about is how on earth you can get better, or you're concentrating on how bad you're feeling, and it's a fairly miserable existence. There's no way I was going to accept at that sort of age that I was going to live the rest of my life sort of in a bed, not being able to do much, and obviously that's about the one and only thing you can do is read. So I did read a lot of books, and that set me on the journey of finding out about health. I must have used about probably 6 or 7 really quite hardcore methods over that period, but I'm one of those people, I didn't really dip in and out of things. I'd give something a very solid go for about a year and a half, and if something didn't work within a year, then I stopped. So I think I followed the sort of nutritional route and extraordinarily clean eating and detoxification for must have been about a year and a half. And I still kept that up, but not to the same extreme. And I then took on something called Gerson therapy, which involves huge amounts of juicing fresh vegetables and coffee enemas, and that definitely helped a bit and cleaned my mind and a fair bit. But I was still always incredibly tired, and it didn't really build up my strength much. And actually, one of its largest problems was it took a huge amount of energy to do the juicing, or my mother to do the juicing, which also adds all its own complications and makes you tired. I think sometimes a lot of people stay ill forever because it becomes their identity. I mean, after you've been ill for 5 years, who on earth are you? Well, for you, you're actually this ill person trying to find a way. You think you're trying to find a way out of it, but I'm not so sure you are, because everything you're ever thinking about is the illness, so you just keep manifesting and recurring the illness. So the absolute eureka moment is when it suddenly clicked in my head that actually, no, it wasn't all these outside forces that was making me ill, it was really me, and I then had to take responsibility for my own health.
Just explain.
One of the catalysts for me was when I read The Field by Lynn McTaggart, and in that book, the reason it was such a catalyst is because it explains how each and every person is completely and utterly interconnected to every other person and thing in the universe. The reason that's important is because you're not actually a separate identity to the rest of reality around you, and as soon as you realise that, you can then take responsibility for your own health and then your own path to get better. I think one of the big links for me is, up until that point, I really believed that the whole body just worked on biochemistry and the genetic thing, and that I was genetically predisposed to getting chronic fatigue syndrome, or that I'd caught a virus, and that the problem was external to me. But once I'd started reading books about energy medicine and books like The Field, like by Lynn McTannock, I suddenly realised that actually everything was interconnected and that I was interrelated to the rest of the world. And by changing behaviours in me and by what I was doing, I could alter the outcome of my illness. All of reality is energy. I mean, Einstein sort of sums it up in his great classic equation that E equals mc squared, which stands for energy equals mass times the speed of light. And what does that actually mean? That means that myself, yourself, this table, this microphone, although they're matter, they're also energy. But of course, they're not just energy, they're actually information and energy. What I mean by information in relation to energy is that energy has a structure and it has a shape, and it's this structure and shape of energy that actually gives us the reality that we can see. It again comes back to this fundamental thing of what on earth matter is, and physicists have been saying for 100 years that energy is matter, and it's summed up in that equation: energy equals matter times the speed of light. So forget about the speed of light for a minute. Energy equals matter. So every bit of matter you see, whether it's us or the table, it's made of energy. But if it was just energy, it would be zooming all around the universe and we wouldn't be able to see it. But what it really is energy with form. It's energy with structure, or I say it's energy and information. And all the information is, it's just structuring the energy. So it's just the structure of energy. Take the human body must have a control system, and by a control system, I mean the system that's controlling all your movement, all your cell metabolism, all your digestion, all your thinking, everything that ever controls the body. Now that control system is of course energy. If you take the nervous system, it's sending alpha and delta waves through and it's pulsating. It's easy to see that that's energy. If you take the lungs, breathing in and out, you can recognize that that's energy. And these energy systems exist all over the body, and obviously one of the largest energy providers is the heart, with its lub-dub sound when it's sort of going boom, boom, boom. And if you take all those energy fields overall, they're actually, with the information, they're actually what's controlling the whole body. So if you take a healer, or all sorts of other alternative medicine modalities, they're able to interact with that energy field. And in interacting with that energy field, or what you could call the body field, I'd actually got a bit fed up of going around visiting practitioners and spending all this money and not really getting better. So I wanted to make some type of healing system that anybody could use in their own homes, and then they'd be able to get better. And by a complete synchronistic event, a doctor introduced me to Peter Fraser, who was a acupuncture professor from Melbourne in Australia, and I rang him up because I had an idea how to make a diagnostic system, but as I was still ill myself, I had absolutely no idea how to get better. So I couldn't make such a system at all. And we got talking, and he flew over from Australia to LA, and he'd been making these information preparations. He'd been putting information of how a healthy body should be into these bottles, and he began to give those to me. And I met Peter Fraser, and he started treating me by giving me these preparations of where he'd put the information of a healthy body into a bottle, and then I was drinking this liquid. And now that's a little bit like homeopathy, but instead of using sort of dilute arsenide and substance where your body reacts against, his idea was completely and utterly the opposite. Instead of taking the negative information, he was instead putting into these homeopathic remedies the exact positive information of how your healthy cells should be. Professor Emoto from Japan did some incredible research into how different words and information can affect crystalline structures in water. And what he did, he took different Petri dishes and he put a drop of water in each Petri dish, and then he wrote on each Petri dish different words and sort of expressed an intention about that particular Petri dish. So on one dish he would write love, on another one he would write hate, or in some other examples he took water from beautiful springs, and others he took the dirty tap water. He also played rock music and also Mozart. And after that, he froze that water. I think it was minus. I don't know. He froze that water at minus 32 degrees centigrade, so that it would become a bit like a snowflake very quickly. And what was so amazing, on all of the dishes where he'd put something positive and warm or coherent music, it created all these amazing, beautiful crystalline structures. And all of the ones where he wrote something rather negative like hate, or had played horrendous rock music, all of these structures sort of disappeared or became all fractured and broken up. What that shows, and it's back to that crucial thing about reality, is that energy can have a structure, and so reality is literally just structured energy. He made me an antidote for a group of flaviviruses, which is a group of viruses responsible for encephalitis. And what was so incredible is within 15 minutes my brow started getting hot and my glands started expanding, and I then had a fever for the next 2 days, and after that I wasn't cured or anything, but I did feel quite a bit better. But the important point to me is that I knew there was something in it. And he then made another preparation, and this one was something he called the heart driver. And again, I took that, and then I started getting these heart pains, and just for the next 2 hours, and it went away. And then each time he did one of these things, and he also made something called emotional stress release, and I just began to feel much more relaxed over the coming weeks. And yes, I was still tired, but there was just huge amounts of information in me that needed to be changed. But because of that, I absolutely knew I was on the right path and with where to go. I think that whole process took about 18 months, and each month, because Peter lived back in Australia and I lived back in America, I posted spit samples back over to him, and then he would test and sort of work on the next part of my information field that was wrong. And then slowly but surely, over about an 18-month period, I just began to notice different symptoms sort of melting away. Like I noticed, my back wasn't really hurting that much anymore, and like my digestion got better. And one of the most dramatic things for me is I was just so stressed, and I'd been really chronically stressed for years. I just began to relax more about things, and especially also because I knew I was getting better, and there was finally some solution. We'll just take an example. If you take an example of your heart, you want it to produce a sort of nice coherent heartbeat, and there's a particular information pattern that will tell the heart how to produce that heartbeat. And so if there was something wrong with your heart, we would give back the information that would instruct your heart how to be healthy again, how to produce that correct heartbeat. So for instance, if you take something like the heart, a nice coherent heart, it has quite a particular nice smooth lub-dub sound, and that information of how that heart should produce that type of sound can be recorded. Our body is very, very similar to a computer. Although it's got hardware, the really important part of a computer, and why Bill Gates has made all this money, is because it runs off software. But today, no one has said much about the software of the body. So what you're doing is when you take information into the body, it's like putting a new software patch into the body on how the body should work properly. And you can do that with the software of the heart, or the software of the nervous system, or the software of the kidney. If you take a different person who might have a different disease, each and every one of those people could be ill for a completely different set of reasons. I mean, you can have chronic fatigue, but it might be because you had a toxic overload somewhere. It might be because you had a huge amount of emotional stress. It could be for a multitude of reasons, and because of that, the corruption in their software, if you like, is going to be different with each and every individual case. So it doesn't make sense just to make one software patch for each and every person. So in looking at that, you have to do a type of diagnostic. So we match the information of a perfect human being back to their software, and we examine the pieces of software code, and you start seeing where the bugs are. And where you can see that there's errors in their software code, then we give back that correct software code. Sure. Before I tried taking information as a type of healthcare, see, most of the time I was still in bed. I was up a few hours a day, but I couldn't really drive a car, and I certainly couldn't have a job. And 18 months later, it's a total 180-degree turnaround, and I'm now running a company, and I've made a movie, and I'm also an avid rock climber, which was my passion before I ever got ill. And after the 18-month period, it's a complete 180-degree turnaround. I mean, I'm now able to go rock climbing 3 times a week for about 6 or 7 hours during that day. I'm also running a company. I've also just made a movie. I'm traveling all around the world to do with my business, and there's not in a million years I could have ever done that 2 years ago. I mean, disease really is just a name, but this type of healing modality, it can actually just help everyone, and it makes everyone more healthy. And in fact, myself and Peter, to this day, I still take information, not because I need to get over any so-called disease, but actually just because I want to get healthier and see where I can take it. How much climbing can I do, or how much can I get out of my life? Well, I mean, the wonderful thing about informational healthcare is that A, it has 0 side effects. B, it's almost free. C, and you get dramatic health results. And what could be better than that? Well, Hahnemann, 200 years ago. Hahnemann, who's the father of all of homeopathy, and homeopathy was born 200 years ago. He didn't know anything about positive information or how to work out how the information of the body should be. So what he did is he took different minerals and different herbs and all sorts of other substances, and he made very dilute versions of them, and he just tried to get the body to react against those, and then he noted down over his lifetime all the reactions that they'd get, and it's an extremely laborious indirect method. And we just said, screw all that, we're just going to instead just work out exactly how the body should be. So we're just taking the positive information of how a cell should be, how a bit of kidney tissue should be, how a bit of lung tissue should be, and instead we're putting that information in. Although our stuff hasn't been through a lot of peer-reviewed things, actually we have had a double-blind study which obviously came out positive, and we do have another 2 studies that are happening at the moment. And it's such a new concept, and we're only one tiny little organisation, it will take another 10 or so years to get all of that type of research that will back up a lot of the cracks, if you like. I mean, there is actually a huge amount of research in a lot of these separate parts of, about how genetics isn't a control system through the epigenetics work. There's a lot of work done through the Heart Mass Institute of how information is imprinted by the heart, and and we've done a fraction of this work as well. So no, there is a lot of evidence, and it is online if you look for it, but unfortunately it's not generally in the mass media, so most people are unaware of it. We call it informational healthcare, and it's called informational healthcare rather than informational medicine, because we believe in caring for people's health rather than medicine, which is sort of looking at a disease process. We're not that interested in disease as such, we're more interested in health, and it's called informational because it's all about putting the right information back into your body. I think it's becoming really quite apparent to huge amounts of the population and government that the whole normal drug-based, doctor-based modality is extraordinarily expensive, and it is actually failing on a mass basis with all the failed drug trials and people dying and all that type of thing. So I think a few things will happen as government realises it's much cheaper to go this way, and they're under huge amounts of pressure, especially with the banking crisis, to save money. That's going to be a way for them to save money. Again, insurance companies, why should an insurance company pay out these massive bills to hospitals and doctors when they can also save money? So I think our next step is to obviously talk a bit to government and also to insurance companies, get the trials that back up what we're saying, but with all the evidence being there and in saving all the money, why on earth would the public not want to do it? I mean, one of the massive problems that we're sort of considering 2 or 3 years ago is we knew all this stuff, and we know that what we're doing is quite amazing, but it doesn't make any difference if the public don't realise. So that's why we made this movie called The Living Matrix, just so that we could help change people's belief systems on a mass scale. We've also recently set up the Institute for Bioenergetic and Informational Healthcare, and that's been set up for just 2 reasons only. One is to do the fundamental biological research, which is really entirely non-commercial in nature, and it's sort of proving the concepts of how a cell is also working off source energy, and proving all the concepts of how information is stored and transmitted in the body. And this could take hundreds of millions of dollars to do properly, so we've set up an institute to help with that. But also its other side of it is also both to educate the public and also to train practitioners in all of the research that has been done. Well, what's the definition of a miracle? Something's only a miracle if you don't understand how it works. But the point is now there's a huge amount of scientists that are beginning to piece all of this together, and it's no longer a miracle. It's the future of healthcare.